Good morning. In this video, we'll be talking about sleep and mainly focusing on the different sleep positions and why you may want to prefer one over another. We'll take various health conditions into consideration, and I will be talking about what I've noticed as a pain doctor, what can ultimately affect you down the road in regards to what position you choose to go to bed at night. So stay tuned and let's just jump right in. Hello and welcome. If you're new here, if you're not, welcome back. I am Dr. Jack. I'm an anesthesia trained pain physician, and for today we are focusing on the topic of sleep because it is such an important thing that we do in our lives. We spend nearly a third of our lives either going to sleep or trying to go to sleep. It's our body as well as our mind's way of rejuvenating itself. And as you all know, that if you don't get a good night's rest, and if that persists for several days, it can really start to affect you, not only from a mental standpoint, but from an overall health and wellness standpoint as well. There have been numerous studies that have looked at everything from what your sleep position may say about your personality. If you sleep in a fetal position, you might be a little bit more introverted versus sleeping in what they call a star position, where I guess your arms and legs are kind of spread out, that you might be a little more extroverted. I don't know about all that, and my background's not psychiatry trained or anything like that, but I do know that's very important. And what I've noticed in my patient population is that sleep position also can affect chronic pain, either currently or in the future for you. And just real quick, we should cover various things that you should do for making your bedroom more conducive to sleep and habits that you should have. So obviously no caffeine before bed. The bedroom really should be reserved for two things, and that is sleep and sex. So if you are, sitting up at night and watching your iPad or reading in bed, that's really not suggested because it can interfere with your sleep. And if you have issues sleeping, various things that works for me is picturing colors. I was reading a study where if you try and picture colors, that can help. CBD can also help. Hence, you can look at all my previous videos about this whole education CBD train that I'm doing. Actually, clinically, what I've noticed is that one of the immediate things that CBD ends up helping very quickly is actually insomnia or people that have issues sleeping. Of course, depending on why you have issues sleeping, if it's severe pain, then that's a bigger deal and may require further workup and other treatment plans. So without further ado, let's just jump straight into it, and we will start off by talking about people that sleep on their back. So for people that sleep on their back, like I do, it is really the best position overall, minus a few nuances here and there. When you sleep on your back, you are sort of dispersing the weight as much as you can over as big of a surface area into the bed as possible. The things that you want to keep in mind that are very important when sleeping on your back is to make sure that you have good head and neck support. I suggest one of the Contour foam pillows. That makes a big difference, and actually I'll link down below the one that I suggest and the one that I bought that I use, and it works really well and it's very comforting because it puts support mainly just on the back part of the neck. So that's for the head and shoulders. And then kind of moving down, as you are sleeping on your back, you want to make sure that you have a good, what's called a lordotic curvature. That's, if you look at your spine, it's sort of shaped like an S. And you want to kind of maintain that good posture when you're sleeping as well. And so some people might stick a pillow underneath their back, and some other people may put a pillow or a towel underneath the back of their knees, and that kind of helps maintain the curvature as well. Keep in mind that at times, depending on whether or not you have certain back issues, it can actually exacerbate back pain. And so, see what works for you. But overall, this is the best sleep position. And what you may also want to know is that people that sleep on their back, it prevents wrinkling of the skin on your face because you're not being smushed on a pillow. And other things to consider is if you have reflux, this may not be the absolute best position, but you may want to kind of prop your back up a little bit more, sleep a little bit more at an incline to keep reflux or GERD from occurring, and better known as heartburn. And you also want to consider if you have sleep apnea, so in particular obstructive sleep apnea. And because when you fall asleep in that position, your tongue tends to fall back a little more and obstruct your airway a little more. So if you're prone to obstructive sleep apnea, that can be an issue. But if you don't have that medical condition, then sleeping on your back is fine. Sleeping on your back is also good for other aches and pains too. If you have oral facial pain, like temporal mandibular joint pain or something like that, where it's a painful symptom of the joints where your jaw attaches to your skull, that can also be exacerbated because if you just think about it, you're laying there and you're kind of pressing on it all night long if you are sleeping on your side and not on your back. So let's say you sleep on your stomach. Majority of people who sleep on their stomach are men. This is really the worst position that you can sleep in. And if you think about it, when you're sleeping in that position, your head is kind of turned to one side and it can lead to face wrinkles prematurely, as well as neck issues. And it's not the greatest for low back pain neither, and that's due to the positioning. And for some people, they might try to put a pillow under their stomach, and that can lead to actually increased intra-abdominal pressure, which then pushes back on the spinal canal, and it can actually exacerbate that pain. But if you have other types of back pain, I have had patients tell me that sleeping on their stomach seems to help alleviate it, but that's pretty rare. And reflux is also exacerbated because, again, your intra-abdominal pressure is sort of increased because you're laying on your stomach. And it can help something like obstructive sleep apnea. That's probably the only benefit to it because you're laying there and all the pressure is going forward as opposed to backward. So in general, if you sleep on your stomach and it's anywhere, depending on what study you look at, from 8 to 16% of the population, then you may want to consider switching and to a different sleep position, ideally sleeping on your back. So let's talk about all the side sleepers out there. And this is the majority of people. About 60 to 65% of people are side sleepers, and there's quite a bit to talk about here. If you sleep on your left side, it can actually decrease the chances of getting reflux disease. And they think because the lower esophageal sphincter, which is a fun word to say, but the lower esophageal sphincter is possibly more relaxed if you sleep on the right side, and it might have something to do with the anatomy of how your stomach lies. If you have heart failure, you may want to consider not sleeping on the left side because that might compress the heart a little bit more. Sleeping on your right side, however, aside from the reflux issue, can also compress the liver. And so it seems that sleeping on the left side might be the best if you are someone that is a side sleeper but does not suffer from any kind of heart failure. However, when you sleep on your side, it is very important to make sure that you have proper neck alignment. And so you don't want to sleep on the side with a pillow that is too soft, nor do you want to sleep on your side with a pillow that has your neck kind of cocked to one side, and you don't want to be kind of hyper flexed in any one direction as well. So proper neck alignment is crucial, and that goes all the way down to the lower lumbar spine. If you're a side sleeper, one thing that helps align the lumbar spine is basically putting a pillow in between your legs. And other interesting facts about side sleeping, there have been some reports of women that are well endowed where they basically sleep on their side, and this can stretch something called the Cooper's ligament. And I didn't really take a deep dive on it, but some people claim that it can lead to saggy breasts. I don't know about all that, but if you're concerned about it, the general suggestion is basically prop your ladies up with a pillow. Another interesting thing is if you are someone who cuddles at night, and that's typically laying on your side, be careful aside from getting your arm trapped under your partner and getting any type of nerve damage, but when people that are cuddlers at night, they release a hormone called oxytocin, and it's actually known as the cuddle hormone. And this can lead to a state of relaxation and lower stress and have a sense of bonding. And it gets released as quickly as within 10 minutes. And so it can actually help promote sleeping. So do with that what you will. Cuddle more, cuddle less, I guess. Sleeping on your side also is important if you are pregnant. If you are pregnant and as the fetus or baby grows within the uterus, it can compress the major blood vessel, the aorta inside of you, and actually lead to fetal distress. And as quickly as, sleeping on your back for 30 minutes can actually lead to significant fetal distress. And so bear that in mind. The side to sleep on is generally suggested to be on the left for that purpose. The other thing is that if you have obstructive sleep apnea, also sleeping on your side might be a little bit better for you as well. And in the world of chronic pain and in my practice, what I've noticed about people that sleep on their side is that there's a higher chance of developing neck strain as well as shoulder pain and bursitis. And so for this, I actually have a high-tech model here to demonstrate all of this. So I stole Moana from my child and locked myself in this room for a second so that I can borrow this and shoot this video. But I wanted to demonstrate with this model in regards to what I mean by that. So if you sleep on your side and if you don't have proper neck alignment, and your neck is kinked, that can over time accelerate arthritis. However, if you also sleep on your side, it's causing a lot of pressure on the shoulder, and you can develop what's called bursitis because of the excess pressure down here, typically along the greater trochanter bursa, which is a bursa that's kind of on the outside of the hip. And this is especially important as to a reason why you should have a good mattress. I would suggest a good foam mattress, and if you already have a bed, then consider getting a foam mattress on top. It can make you a little bit warmer, but in general, it offers a little bit more cushion. The other thing to keep in mind is your weight has a lot to do with this as well. So the worst combination is you have a pillow that's not the right height, combined with being overweight, which is excess pressure on all those points, combined with a, say, very stiff bed. And may not happen overnight, but over a period of time, you can develop these types of chronic pain issues. Let's wrap it up by me discussing my general preference or opinions on sleep. So I sleep on my back, and in my opinion, the most comfortable position, but everyone has an opinion. And ultimately, take everything that was said in this video into consideration and decide what's best for you. I would suggest making the appropriate changes. For some of my patients that were historically side sleepers and came in and had neck, shoulder, or bursa issues, talk to them about how to sleep on their back. They've come up with all types of crafty ways. I had one guy cut some socks, pull them all the way up to his sleeve, and then put tennis balls on each side. And this way, if he can't roll onto it without being very uncomfortable in the middle of the night. Other people just basically sandwich themselves in with pillows so that they can't roll over onto the side. Do whatever works for you, and so that you get a good night's rest, which is obviously the most important thing. And if you do have various aches and pains, then obviously bring it up with your physician because it may require a bigger workup. And so with that, that's all I have to say about sleep, sleep position, and how it can affect various health issues as well as possibly create pain or cause pain. I hope you enjoyed this. If you do, please don't forget to smash that like button as well as subscribe for future content. This channel will be focusing on health, wellness, and mindfulness long term, and I'm pretty good about uploading weekly. Please feel free to comment down below. I'm very good about responding to those. So till next time, take care, stay safe, bye-bye, Pura Vida. Good morning. Let's do that again.